Here at ASH 2013 in New Orleans, we have with us Lynn Wang, MD. She is new to the University of Chicago Medical Center. Thanks for being with us.
Thank you for having me here.
Okay, let's talk about the abstract and the data that you're presenting.
So we presented an abstract on a compound. The name of the compound is PRT2070, and this is a dual inhibitor of a JAK STAT pathway and B-cell receptor signaling pathway. So, we tested it out in the lab regarding its anti-tumor activity against diffuse large B-cell lymphoma, which is one of the most common lymphoma in the world. And so we found that this particular compound has a very broad anti-tumor activity against two subtypes of diffuse large B-cell lymphoma. So, so basically what makes this compound unique is a broader activity. Normally, the available drug, molecularly targeted therapy, is either against ABC type of a diffuse large B-cell lymphoma, or is a GCB type of a diffuse large B-cell lymphoma. So this particular compound, because it targeted two pathways, and so it got a double hit on the tumor cells. And so, so in that way, it targeted GCB type of a diffuse large B-cell lymphoma primarily through the B-cell receptor signaling pathway, the Syk activity part of this compound. It also targets JAK STAT pathway, which is more active in the ABC subtype of lymphoma. Given the lymphoma incidence, so given this drug has a much broader activity, so this is very unique compared to the currently available treatment options or like a therapeutic, experimental therapeutic agents in the market or in the clinical trial stage.
So people are wanting to know when this compound will be fully developed.
So currently my group at the University of Chicago is doing a lot of preclinical studies. So we compared this compound with other compounds like a Syk inhibitor, BTK inhibitor, and so far this compound has the most potent activity against tumor. And as far as I know, Portola Pharmaceutical is a company that we collaborate with, and they have this compound. They provided this compound to my lab to do this preclinical study. But in the same time, they already developed in the clinical studies. The phase 1 trial was opened in October 2013, so it's a little over a month ago. And then they have already recruited the patients into this clinical trial. So, we are very eager to see the early clinical trial results and how this compound, whether the results we obtained in the lab will translate to the effect treating lymphoma patients.
So where will you go next in your research?
So, for the clinical trial, we have a plan to do something called a para-clinical study. So we are going to collect the patient's specimen before and after clinical trial. And then we are going to analyze these samples. So compare the before and after, and to see what differences this particular drug induce in the patients, and how that correlate with the patient clinical response. So that study has been planned and between Portola and my group.
Very good. Dr. Wang, thanks for being with us. Continued success.
Okay, thank you.